Welcome, dear friends, to Toni Talks Humanity Matters, a safe and sacred space where we can elevate our health from our mind, body, and spirit so we can show up in the world as a loving and inclusive presence and encourage everyone around us to do the same. I'm Toni Julian, your host, and today we're delving into one of my favorite topics, how to help women elevate their self-care, and more specifically, how to achieve radiantly healthy skin. My guest today is Dr. Simran Sethi, an internal medicine doctor. She has 2 decades of experience treating patients on a clinical and an aesthetic level. Dr. Sethi has cultivated her skincare line by focusing on both how the skin is impacted from the inside and out. Dr. Sethi has completed extensive hospital and clinical training as an internist and has additional expertise in aesthetic dermatology. Dr. Sethi has had the privilege of meeting and treating thousands of women of color in her Bay Area medical spas. Her profession and personal experience with treating melanated skin led her to develop Skin by Dr. Sethi, the only medical grade systems-based line for women of color. She also has her own weekly podcast that focuses on beauty, wellness, and beauty trends, especially as they relate to people of color. In addition to being an MD, Dr. Sethi acquired an executive MBA from the Wharton School, the University of Pennsylvania. She is also a leading provider and key opinion leader for Cynosure Lasers, the world's leading company in energy-based aesthetic and medical treatments. As a key opinion leader, Dr. Sethi leads specialty programming panels for treating melanated skin for other medical aesthetic doctors seeking best practice protocols. It's a genuine privilege to welcome you here today, Dr. Sethi.
Thank you. And I'm very happy to be here.
Thank you. Well, I appreciate your time. I know your schedule is completely booked every day, so your time and expertise is very much appreciated. So would you share a little bit about your background and why you focused on dermatology and how you started out as an internist, but then ended up doing what you're doing?
Yeah, a lot of people ask me that. And I think that if you ask any doctor why they went into medicine, they will always or almost always say that it's because they wanted to impact people's lives and make them feel better and happier. I used to practice entirely in the hospital, and I found that while my patients were alive, they got better, but I never saw them leaving happier per se. Maybe they were a little relieved. But but then I also personally was going through my own kind of skin journey, trying to help myself achieve healthier, more glowing skin. I had some acne scars that had plagued me for years, and now that I was a working adult, I could seek professional help to address that. And I found that, and I found two things. I found that aesthetics does make people feel happier. When I see thousands of people every month, and they leave our offices feeling more confident and happier. And I wasn't seeing that in traditional internal medicine. So I enjoyed that aspect of it. And I also found that I was meeting women who were very much like me. They were professionals. They were really ready to really elevate their skin to the next level, but weren't finding the solutions for it. Or there was so much overwhelm in the market that they weren't getting to the solution. And that, I think, for my own personal or selfish reasons, inspired me to enter the aesthetic field. And the practice of medicine means that you learn every day, learn new things by trying new things. And that's really what I've been doing for the last, I would say, 5 years. And that's how and that's brought me to developing specialized protocols for more melanated skin like myself, and a skincare line dedicated to that.
That's beautiful. And that just, I'd love to touch on a couple of points about what you just said. I think it's one thing that you mentioned, and I think it's so important to make that distinction between the societal pressures on what we as women feel like we need to do to feel or look beautiful and to be healthy, and what we want to do for ourselves to make ourselves feel good. And it's that feeling of feeling good and of that self-esteem and elevating. So do you have advice for women how to make sure that it fits within their healthy mindset and it is going to contribute to them in that way?
I think that one of the things that I've learned in practicing aesthetic medicine is that we all judge ourselves so much, but also that as a society, we've also developed some sort of very rigid guidelines on what is beautiful and how to feel beautiful or how to feel confident. Um, but what I will say is, and after meeting so many people, it's everyone has their own special way of feeling confident. For some women, all it takes is straightening their hair and they
Mm.
feel like they're $1 million. And for some women, it's just putting on lipstick. So exactly. So it's like find your way, your way of self-care. Self-care could just mean eating breakfast alone without the hustle and bustle of children,
Mhm.
right?
Right.
Um,
Right.
so it doesn't have to be expensive. It doesn't have to be very time consuming, but it has to be deliberate. And when it comes to beauty regimens, which is a lot of people associate self care with beauty regimens, and I think that is I think a strong association because you also get a result. If you take care of yourself, you result in looking healthier, looking your more optimal self. So don't feel guilty about that. If find something that fits your budget, do it consistently, get your alone time, even that 10 minutes of your beauty regimen can really reinvigorate you.
I so agree, and I love your point about the consistency of it. And I think as a woman getting through many many decades of experience, and start seeing the age, it's like it sometimes it does just take something simple to do, and that we do for ourselves. And I think also in our society, oftentimes we feel like doing something for ourselves is selfish when
Mhm.
that's the furthest thing from the truth. Can you talk about that a little? And have you had experience with some of your patients who may sometimes feel a little guilty about doing good things for
Oh,
themselves?
absolutely.
Yeah.
You'll be amazed at how many moms will bring in their young, their young adult, their 19, 20-year-old daughter or son saying that my child has had acne for a long time and now they have these scars, and they wear their hair like this because
Ah,
they're so ashamed of their scars. And I'm looking at mom too, because she's clearly dedicated so much time and attention to her children. And so I always ask them, and mom, how about you? Is there something we can do for you? And they're just like, oh, yeah, well, no, I just want to take care of my child first. And I totally understand if it's a budget thing, but you know what? Oftentimes it's not. It's a time thing. And when we kind of open up that conversation of, you can squeeze in your appointment at the same time. Why don't you get even a facial for yourself? And I've seen people go from just that simple act to going, oh, I can actually do things for myself. But you're right, it has to be so deliberate, and women have associate a lot of guilt with it. I also think it's our culture. With social media, social media can be such a blessing, or it can really misinform people.
mhm.
So you see influencers who are doing all sorts of things, and I think it increases the expectations for parenting a lot of times. So that's why it's very hard for mothers, especially, or women especially, to stop and do things for themselves.
I totally agree. And I can say, as a business owner with 4 kids, I have been through
Yes,
all
for
that.
sure.
I have more than been through all that. And I started realizing that it really comes down to self-love, and how I had a client who came in, and he wasn't treating himself well, and I said, "Well, you have a 5-year-old boy. Would you send your 5-year-old to school with a couple of carrots for lunch and to be there for 12
Yeah.
hours and not have a nap?" And it's like, treat yourself the same way, at least, as you would treat your child, because it's so easy for us to take care of our little succulent plants, and our little dogs, and our children, and our parents. And I get pulled between, or I was at one point, the 4 kids and the ailing parent. And we women just get stretched. But there's still time, because it doesn't take much. It could be 5 minutes, go sit under a tree, right?
Exactly. And I think the other point you bring up is you also, if you have daughters, I have two daughters, when you take the time to give yourself that self-love and self-care, you're teaching them the same thing. And you're
Yes.
this example of the mom bringing in her daughter with acne scarring, I'm sure that mom would love to see her daughter take care of herself as she grows older. But you don't instill that unless you also demonstrate it. And I think that teaching your child, teaching your spouse that this is an important part of your day, it's your responsibility. I don't think, I know I love my husband. He's the supportive, sweet person, but he's never going to say, Simran, I need you to stop and take 10 minutes to take care of yourself.
I know. If we don't do that for ourselves, if we don't tell ourselves, if we don't think, I mean, it does come down to self-love. And I profess this just all the time is self-love is the foundation of self-care. And we are even taught not to love ourselves. Some of us have trouble saying, I like myself. Took me a long time to say, I love this person. I love myself.
Yeah,
Right.
sometimes don't you look in the mirror and you go, wow, I look really nice today.
Yeah.
And that's okay.
I do. I'm like,
Yeah,
looking good.
exactly.
And it's like,
Exactly.
great hair day. And it's totally okay for women to say, I look beautiful today. I look radiant today. And just that positivity and being heart-centered and living in your heart. And then you get this, what also I love about what you talk about is the inside out, right? Is treating yourself from the inside out, from like a not just a medical standpoint, but mindset. And once we have that mindset and we have that feeling inside of, I am loving, I'm a good person, I deserve good things, then that opens us up to
Oh,
not just a healthy mindset and a radiant personality and just glowing from within, but it allows us to
absolutely.
do that self-care.
Oh, Tony, I'm glad you brought that up because in my specialty, we do a lot of skin procedures. We do Botox, fillers, all sorts of procedures, right?
Right.
Body sculpting. And you can ask all the 20 team members who work with me, if we have two people who are identical ages, and they come in with similar, let's say, skin issues,
Mhm.
but one has a very positive personality, just an overall positive outlook. And the other one does not, just a very negative person, very hard on themselves, hard on others as well. We could do the identical things to them, and the results will be night and day. There's just something about that mindset that gets in the way of even results where we're using the
Mm.
same technology, the same number of sessions, everything, but the results are completely different. So there is a lot to say for your outlook, just showing up on your face and your skin, your body.
Right, right, and it just proves we are more than just a bunch of cells clumped together,
Exactly, exactly.
That's that whole approach that I have been professing to people. It's that mind, body, spirit, everything is connected. Right.
Absolutely.
And then it's also kind of, one impacts the other and impacts the other. And so sometimes, it's the physiology follows the psychology and
Mhm.
sometimes the reverse is true. So sometimes if we just do a little something nice, like I came into your office, I will share this with our listeners and our viewers. I came into your office for a treatment and, it took a couple of months because sometimes it takes, we're actually building elastin and all of those other, you are much better at describing that. But it's just that little boost that connects to everything else that just makes that radiance come out. And
Exactly, exactly. And you really wear your confidence on your face, and there is definitely, I know, and in the scientific world they like to see studies and things, and showing that. And but I will say, just from our more applied experience and studies, I think 100% someone's outlook coming into a set of treatments in our field, makes a huge impact on their results.
yes, yes, I absolutely agree. And so One thing that you are very involved in, and you brought up your skincare line earlier, is helping with women of color.
Mhm.
Can you explain to us some of the conditions that are
Yes.
more that affect these people?
Yes, exactly. So women of color or people of color have, so we're all born with the same amount of melanin, no matter what our
Mm,
skin color. But the activity of melanin is increased in people of color, which means that any kind of any exposure to something that their skin does not like or tolerate will result in more melanin production, because those melanocytes, the melanin producing cells, are sitting in our superficial skin layer. They are protection. They're protecting all of our collagen and elastin, which is sitting in our dermis, which is our deepest layer. So as a just genetically and by evolution, our people of color will produce more melanin in response to things. Now, what those things are things like acne. So if you
mm,
have a young woman who's Caucasian and she has once her acne calms down, she will just not have anything else on her skin. Her skin is going to look very clear. A woman who's South Asian or African American is going to, those pimples will clear, but she'll have these dark spots all over her face that
mm,
could last for years and years, because she just has more melanin activity. So all of our, so when it comes to addressing skin of color, their concerns are always have to do with dark spots and hyperpigmentation, and less with skin losing its elasticity, less wrinkle formation. Not that that doesn't happen, but it happens a little later in age, and most of their disorders are pigment related.
mm,
Um, but the problem in traditional aesthetics is that many of the strategies we use for pigment reduction in lighter skin tones actually increase pigment production in darker skin tones. So lasers are a very good example. Most lasers expose our melanin producing cells with heat and light. And those are exactly the two things that melanin producing cells don't like. So as a result, they produce even more melanin because they're programmed to do that. So that was one of the biggest challenges entering into aesthetics, finding solutions for people of color. And then when it's not just procedures, but then when it comes to skincare, the traditional approach to melanated skin has been to fight melanin production by using products like hydroquinone, which does reduce melanin activity, but at the cost of causing a lot of inflammation in most cases, which then increases melanin activity. So you're thinking now,
yeah.
okay, so what should they be doing? Or a lot of skincare companies will use very harsh exfoliants to try and slough off darker skin, trying to reveal lighter skin or clearer skin. But that actually, again, in darker skin tones leads to more inflammation. So the approach that I like to take is, let's work with your skin renewal cycle, because on a daily basis at all times we are all producing new skin, so that we can always build this protective skin barrier. If you support that new skin production appropriately at each step, you will balance production of melanin, because melanin has a job. Its job is to prevent you from forming fine lines and damaging your collagen. So let's let it do its thing at a balanced level, just like it would in a young child or a baby. And let's repair the skin, not keep fighting melanin at the cost of breaking that skin barrier. So a lot of women of color tend to use products that contain hydroquinone, or they'll buy really high potency vitamin C cream, or they'll try retinol because they've seen that it can cause clearer skin. But in their case, it's causing them to peel excessively because they're going for very high concentrations. So let's stop using one product to fight melanin production. Instead, let's nourish the skin renewal cycle at each step, so you balance and down regulate abnormal production. And let your melanin do what it's naturally programmed to do, protect you from all the things that people are buying skincare products to do, like fighting wrinkles and sagging skin. So that, I know it's
Yes.
a very long explanation, but that it is a philosophy.
Well, yes. Well, there's so much to it, and it's fascinating to me. I was not aware of that. I just thought, well, maybe it doesn't show as much on people that are
Mhm.
lighter complected, but that's completely not true. It sounds like the procedures and products and things that would be to treat somebody with lighter skin are actually very traumatic for people of darker
Exactly,
skin.
exactly. And you will see, if you go to a physician who's very responsible but not experienced in treating melanated skin or darker skin tones, they will likely turn you away. If you're, someone of my complexion. And that's actually what was happening with me. I was going to dermatologists who were actually people I know I've worked with, and they all told me the same thing. Well, I can't use lasers on you because I know that that'll worsen your pigmentation. So how about try some chemical peels, maybe some hydroquinone, and yeah, that's probably the best we can do because we're not going to try and harm your skin. And I know a lot of people get that response. So, and in a way that's safer than some of the things that I've seen in the aesthetic industry where people have tried things that should not be done on their skin and now, resulting in, greater damage and so forth.
Yes, exactly. So what happens, and when my mind's just wandering here a little bit, what happens when you have someone of mixed ethnicity? So
Mhm.
take me, for example. I look fairly light complected, but I'm half dark Italian. So I know genetically my skin structure is going to be different from someone who, say, I also have a quarter English and a little bit of a little dash of Swedish thrown in.
Right.
So how would you treat somebody even a little differently when there's a little bit of both? Because I
Yes,
know a lot of us
exactly.
are very mixed ethnically.
Exactly. No, actually, that's a great question because I have quite a few clients who are part African American, a part English or Caucasian. So your skin and melanin production behaves more like the darker portion of your ethnicity. So I
Mm,
like to ask people what their ethnicity is, but I also like to ask how they tan because that's really what tells us how you're going to respond to different types of treatments. So if you are now, if you, Tony, go out in the sun and you tell me that, well, it takes about a good 2 hours before I start to burn, I can get pretty nice and brown before I get a sunburn. And in my case, I can be out for 2 hours and I will never burn. I'll just keep getting browner or darker. So then I know your Italian side is a lot more predominant. It's dictating how your skin behaves, and I would classify you as a skin type 3.
mm.
But if you told me that it's in about 30 minutes of being out in the sun, you start to burn, I would say, well, that's your English side, and you are a skin type 2. So that's how you tan will determine how you respond to treatments and what are safe.
I see. So I am a 2. Definitely.
Oh no.
Oh, no, I know it. So skin type 1 is very light and fair and porcelain-like, and skin type 4 is very
Yeah,
dark,
so there are
and the
six
2 and
skin
3.
types.
Oh,
Mhm.
6. Okay.
Yeah, there are six. So skin type 1 is someone who is very fair and usually has red hair. That's a very typical skin type 1, or very fair blue-eyed blonde. And skin type 2, fair brown hair. But again, both skin type 1 and 2, usually in about 30 minutes or so, they will start burning if they were in direct sunlight. Skin type 3 is more of someone who's maybe more Mediterranean. So they have pretty dark hair and can tan. They can get darker without burning. So an Italian is a very good example of that, someone who's of
Mhm.
Italian descent. And then skin type 4, a very good example is women of Indian descent, Asian, Chinese, Korean, Filipino. They all are in that skin type 4 category. A skin type 5 would be someone who is a little darker. So even in India, there are people who are, they have just more melanation in their skin. So that would be classified as skin type 5. A lot of African Americans will get classified in the skin type 5 and 6 category as well. So there are actually 6 skin types.
Thank you for that. The research I've done, only 4 have ever been brought
Yeah,
up,
and
but
a lot of
it's
it is, yes,
interesting.
it keeps changing, and things keep getting added. Yes.
That's great. Yeah, we learn more as we go. So that leads me to sunscreen usage. Can you talk a little bit about that and how that impacts these different skin types as well?
Yeah, so when you're thinking so decades ago when we thought of sunscreen, we thought, well, sunscreen is a great way to protect yourself from getting a sunburn. But over time, we found that actually it's sunscreen in the United States, for example, has is controlled and regulated by the FDA because it is considered it's almost like a pharmaceutical that prevents skin cancer. So it's a cancer prevention intervention. But sunscreen, when you think of sunscreen, a lot of people think, do I have to wear it if I'm not going to be out like on a hike? If I'm just in my car, do I even need sunscreen? Do I need sunscreen if I'm a little darker skin tone? Because I don't burn. So the answers to all of that is everyone needs sunscreen. And that's because the sun, even if you are darker and you have more melanin that filters out the harmful effects of UVA and UVB rays, which is what is abundant in the sun, it can't do it to the extent that sunscreen can. So even if you are darker and you don't have a tendency to burn and don't have a tendency to form wrinkles, you still need sunscreen because you will form that over time. So it is something that is a great idea for everyone every day. And a lot of people forget that sunscreen is also needed to protect, even if you're home, right? You're sitting by the window, there's a lot of incident sunlight that comes on your
Hmm.
skin. So even if you're indoors, you actually do need sunscreen. And then last but not least, something that a lot of people don't realize that the sun's rays have is blue light or HEV light. And blue light is abundant outside. Actually, it's more abundant than UVA and UVB rays. Blue light is very abundant inside. So fluorescent bulbs emit blue light, computer screens, phones emit blue light. And over the last decade, we found that blue light actually penetrates deep into the dermis and breaks down collagen and elastin. So incorporating a sunscreen or a serum that has blue light protection is also becoming increasingly important.
That brings me to your amazing sunscreen sample that I was able to try out, and I loved it. It smelled good. I mean, aside from all of these other amazing effects, it just went on so beautifully. I really loved it, and it was slightly pink tinted, uh,
Yes, yes,
but it doesn't create any color on the skin or any
exactly,
zinc
exactly.
oxide or any residue. Is that right? Can you talk a little bit about that? Because I'm particularly interested in.
Yeah, so when you're choosing a sunscreen, one of the things or some of the things to look for are well, a lot of people already know about SPF, but SPF essentially tells us how long your sunscreen will be active in continuous sunlight exposure. So it doesn't mean that if you wore sunscreen in the morning and then got in your car, went to work, your sunscreen has necessarily broken down. It just means that if you went out in the sun and stayed there for 30 or 40 minutes, it's testing the sunscreen's durability in that kind of a scenario. But having an SPF of 30 or greater is what is recommended, and that because if you go higher than that, there are sunscreens with an SPF of 50, 70. What happens is your sunscreen becomes really pasty and hard to apply. So it's better to go to an effective SPF like 30 or 40, minus 40, and so that you can at least wear your sunscreen for a long period of time. And then the other factor is the ingredients. So sunscreens that contain zinc and titanium oxide provide a really nice physical barrier to your skin, which is why and it's active immediately. So that is something that is important to note because there are a lot of sunscreens that are chemical barrier sunscreens that contain avobenzone, oxybenzone that are actually banned in places like Australia and Hawaii because first they have to absorb into your skin, and that takes about 30 minutes. So they're not even active. Plus, they create a lot of sensitivities. A lot of people will get skin sensitivities to sunscreen because they just are not tolerating that chemical absorption. And secondly, they found to when swimmers wear these kind of sunscreens, it's actually killing the barrier reef. So yeah, so in
Mm.
general, those are not great chemicals to put on your body and absorb. So
I'm glad you talked about that. I just got back from Maui, and there were signs everywhere to watch the sunscreens, look at the ingredients, and not to wear them in the water for that specific
exactly,
reason.
exactly.
It's so important. Okay. Well, very, very good. So, can you talk a little bit more about the common issue that we all ultimately face eventually, which is aging and not just the pigmentation, but the breaking down
Mhm.
of our skin and what we can do, hacks at home that perhaps we can do that are maybe low cost versus treatments that are non-invasive that you might also
Mhm.
offer.
Well, one of the things that everyone can do is incorporate a retinol into their skincare regimen. Retinol increases your skin cell turnover, which means it makes your skin behave like it was turning over and making new skin in your 20s. Because as we age, our ability to make new skin goes down. And in our 20s, we're making new skin every 2 to 3 weeks. In our 30s, that goes down to every 3 to 5 weeks. In our 40s and 50s and beyond, we're making new skin every 8 weeks or so. So when you make new skin, you repair, you correct pigmentation, you correct fine lines, unevenness in your skin tone. And that's why being on a retinol is really going to help you fight wrinkles, make your skin stronger. It's an excellent intervention that anyone can do. And it is something that's relatively lower in cost. So I would say if you can incorporate a retinol into your skincare regimen, that's excellent. The other one is as we age, we also become our skin gets a little drier. So if just because you didn't need a moisturizer when you were younger, start incorporating some sort of lipid barrier promoting product into your skin regimen. So a moisturizer that has a lot of good lipids is going to help build your skin barrier, especially if you're using retinol, because retinol tends to dry the skin out. So those two interventions are really important and something everyone can do. And that's more skincare, but even things like getting a monthly facial or every
Hmm.
6 weeks get a facial that can and what a facial really does is it sort of especially microdermabrasion, it just takes off that dead skin cell layer so that you can absorb your products a lot better throughout the rest of the month. So it really helps actually with product penetration
Hmm.
more than anything. It gives you a little glow too, but it's really the purpose is better product penetration.
I had
And
no idea. That's amazing.
yeah, exactly. And it's easy and it's much easier to do. Of course, now if you want to really kind of go to the next level, we are so lucky that we live in a time where we have special lasers, special micro needling, and all these procedures that are safe for all skin types, where we can start boosting collagen production and really giving a very much stronger signal to make newer, healthier skin and repair things like scars or deep lines and pigmentation.
Right. And they're non-invasive.
Exactly. You could come in during your at the end of the day or during your lunch break, get a procedure done, and you'll be back at work the next day. You can, and some of them you can walk back into your office that same day, and most people won't even know that you had anything done, which
Especially if you're
really
wearing a
makes
mask, right?
exactly. There you go. No,
It's
that
like,
is very true. And I think that that's always something people ask, right? Like, I don't want downtime. I really don't I can't take a week off to do a skin procedure. And honestly, and in this day and age, you don't have to. There's I can't think of any procedure that it will probably leave you pink for just maybe a few hours to a day, and you should be able to go back and have a completely normal day the next day.
yes, exactly. That's fantastic. So, if we can talk about one of the last topics is, and as you know, I'm an author and a nutrition coach, is the role of healthy eating. And we talked earlier about cellular turnover and doing certain things, not just for people of darker skin, like helping their natural body's ability
Mhm.
to to turn over, but also with some of the topical treatments that you talked about. Can you weave in nutrition now? Because
Oh,
I think that's
absolutely.
also very important.
It is extremely important. When we think of serums and creams, we're thinking of sort of like topical application and working in this direction, right? Externally going in. But internally and more and I think actually more effectively, your diet makes a huge impact on your skin. So we know that excess sugar consumption causes things they're called advanced glycation end products, or AGEs. Basically, sugars attaching to proteins on our cells to make those proteins not behave the way they should. We see this in our blood vessels. That's why people with diabetes will have atherosclerosis, they have really hardened blood vessels. They have more heart attacks, strokes, so forth. We see it in our skin too. Sugars will go and attach to the collagen and elastin proteins and make them make and kind of change their shape so that they don't cross-link the same way. Our skin it's a network of collagen and a network of elastin bound together, making our whole skin layer. So imagine if we added these little sugar molecules that are stuck to these proteins, and now they can't attach and link the way they normally do. Now you have a breakdown in the integrity of your skin. So sugar it has the same effects as pollution and smoking on your skin, and a lot of people don't realize that. So and I'm not saying that completely stop consuming sugar, but adopting a diet that is low in sugar and substituting to satisfy your sweet tooth, substituting with fruits is a much more healthier intervention for your skin, because it will reduce your sugar intake. It will promote intake of antioxidants that we know help with your skin, and water and fiber.
Yes, all those things and all the phytonutrients and give our
Absolutely.
body the nutrition it needs to rebuild the way it's
Exactly.
supposed to. Yes.
Exactly.
Okay. And what about sleep?
Oh my God, sleep is huge.
It's
And
huge.
in the San Francisco Bay Area where we're located, a lot of people work with teams that are in different parts of the world, and they're not getting enough sleep, or they're getting interrupted. So our skin has been studied, and it's very clear that skin follows a circadian rhythm, just like the rest of our organs do. So our brain regenerates when we sleep. Our skin regenerates. When we sleep, we are producing the most skin cells. So that's why sleep has a huge impact on how your skin looks. And you really need to rest that body to allow all that repair and regeneration to occur. And also for all of that to occur at night. So many studies on workers who are nighttime workers have been done, and they've been shown to have an increase in the number of strokes, heart attacks, and just adverse health events. But in general, skin also, like other organs, follows a circadian rhythm, which is why sleep is so important.
I had no idea about that. And certainly sleep, I've seen it in terms of people's health and wellness and their repair, and that it happens at night. But I had not really thought about how it related to skin. That's so interesting.
Yeah, and that's why actually when you use your retinol, I'd recommend you use your retinol only at night. In the
Hmm.
day, you don't need it. It also breaks down in the sunlight, so you're just wasting it. But at night, when you are doing that active skin cell turnover, that retinol is really going to help promote that.
All right. And when we talk about a good night's sleep, I have a number in my mind, but can you tell me how many hours you think is optimal for people on average?
It is really true. 7 to 9 hours. Everyone's a little different. There are people who do great with even 6 hours of sleep. So it's a little unique, but 7 to 9 hours is pretty much, when we look at a bell curve, most people fall into that.
Well, I'm tipping that bell. I'm 9 plus.
Well, good for you.
I am 9 plus, and I don't feel great on 7 at all, and 8 is just kind of marginal. So I'm just a
Yeah,
huge
exactly. You
advocate
kind
for
of have to
sleep.
play around
Mhm.
and figure that out, just exactly. I can handle for me a good solid 8 hours is great. But anything like you said less is actually like I can really tell the difference.
Well, and certainly with your background of getting your PhD and all of the work you had, I can't imagine you had a solid night's sleep very
Yes,
often through
yes,
all
the
of that.
residency training in medicine can be, it's a lot of work, and, you know, you take these 30-hour call shifts where you're awake the whole time, so definitely not designed for good health or good skin. Luckily, though, it's a short, you know, uh, oh, I guess not short, it's 8 years, but it's
Yes,
a long
yes.
time, but in the grand scheme of things.
Well, the outcome is worth the
There you go.
sacrifice, right? That's so great. Are there parts of our body that we ignore? Do people say, okay, because I bring this up, just a little sidebar story. I show my daughters, I have 3 daughters and a son, and I show my kids, I said, look at my hand. Now look at my foot. And the difference in the aging, the
Mhm.
spots, the thinness of the skin, it's like my foot is 20 years old and my hands are in their 50s or 60s, right? It's such a huge difference. So when we use these products, when we do our self-care, what parts of the body should we be focusing on?
You know, I think one of the areas that, like you mentioned, that is very ignored is are your hands and the
Mhm.
neck. A lot of people forget about their neck and that it is part of your face. So that is an area that for sure, you know, now you're working up here. Let's go down here. Let's take our product down here. We use our hands to apply our product. So let's put a little bit on there. And I totally agree. And if you pick up your skin on your hand and your neck, you will feel that it is thinner compared to even your face and other parts of the body. So it does need a little extra care, but we a lot of times, especially the hands, really ignore them. And you're right, there can be such a disconnect between what your face and neck looks like and your hands look like. And you know, there are procedures where you know, whatever procedures you do on your face and neck, you can totally do them on your hand. Even things like fillers to put in your hands to help them look a little more youthful.
Mhm. Yes, exactly. And one of the things that I do is when I use product, instead of putting them on the palm of my hand, I'll put them on the outsides of my hands
That's
because
a
it's
great
going to
tip.
be absorbing. Why absorb it here and waste all that good product? I'll
Absolutely.
put it here, do the mixing or the blending there if I need to, and then apply even
Exactly.
sunscreens, and that way I know I'm covered. So, are there any specials or anything, any
Yes, yes,
offers that you have
actually
for
I
our
do.
viewers and our
Yes,
listeners?
so,
Yes.
you know, for all our listeners today, if you go to skinbydrseti.com, of course, all our products for a first-time purchaser are 15% off. But, you know, for Tony and her listeners, we have a special code, Toni, Toni 20. So it's another addition, it's 20% off. And we have our, you know, my line is mostly systems based, but don't feel compelled to buy a whole system of skincare. You can also look at my array of hero products, which is serums, retinol, sunblock, things that I feel should definitely be considered to add to if you already have a regimen that you like.
Yes, and for people who may live out of the area, Dr. Sethi, how can you ship products? How can we
Absolutely, we
accommodate
ship
them?
nationally. So, so Skin by Dr. Sethi is a national line. So yes, just like, and it's a very easy process. So if you, wherever you live, you have access to all those products.
That's fantastic. I'll be sure to put your links and all of the codes and everything
Great.
as a part of what we're doing here. So, Dr. Sethi, I so appreciate your time and sharing your
Well, thank you
super
for inviting
valuable
me.
insights. And you are just a joy, and your skin is fabulous. You walk the talk. You're
Thank
a
you.
wonderful example for women and for strong women and for women of all colors. So, I very much appreciate you and what you've done.
Well,
So,
thank you,
thank
Tony.
you. So I hope you've all enjoyed this episode of Tony Talks Humanity Matters. Be sure to check the links posted below for your discounts and to be able to connect with Dr. Sethi. And please share, like, and subscribe. And that way you'll be sure not to miss our next episode. Okay, thank you so much from my heart to yours. And this is where Dr. Sethi would give everybody a little bit of love. Thank you so much, everyone. Bye-bye.